is Rimsha Ashad, and I am here to talk about something which is called as nutrition psychology. So first of all, I would say about what is nutrition psychology. Nutrition psychology is a study of the mood, behavior, and the mental state. And the nutrition psychology is a relationship between the diet and the nutrient intake patterns and our mood, behavior, and the mental health. It's the common proverb that the good food leads to good mood. There are different diseases which are directly linked with the food intake. There are certain diseases which are aggravated by the certain substances that are present in the food. And a nutritionist alone and a psychologist alone could not deal with these problems. These psychology include the autism, bipolar disorders, compulsive disorders, schizophrenia, and depression. All of these are related to nutrition and psychology and as well. And the intervention related with the nutrition and the psychologist both is important for the treatment of these disorders. So it is important that a nutritionist and a psychologist work together for these problems. Now I will talk about certain food components which affect the mental health and are related with the behavior and the mood. So the first of all is the sugar. The use of the sugar is very common among us. Sugar leads to the cascade of biochemical reactions that result in a chronic inflammation in the body. Sh- Sugar is associated with schizophrenia and depression. There are different studies which have found that high intake of sugar worsen the schizophrenia and depression who have been taking the high quantity of the sugar. Sugar is not just the empty calories. Instead, it increases the rate of the depression and anxiety, increase the mental illnesses, decrease the learning ability, different dental problems, and the liver problems. Another important food component, which is the omega-3 fatty acids, is its effect is opposite to the sugar. Sugar promotes the depression, but omega-3 possesses a protective effect against depression. But the point here is that it cannot be manufactured by our body. So we must take them in our diet. It helps to reduce the inflammation and reduce the risk of the heart diseases and help to reduce the depressions. There are different studies which have found that there is a protective effect of omega-3 fatty acids against the depressions, which includes the APA and DHA in the mood disorder. There are certain substances, chemical substances, which are made in the body. These chemical substances are called as endorphins. These produces a positive mood state and it promotes sensitivity to the pain and help the relieve stress and depressions. And it is basically released when a person is doing exercise. Now I would talk about main part of this session, which is what diet is important for the brain health and the mental health. It is important to have a shift between the processed and the trans fatty acids food to the healthy foods and the healthy fats. There are different factors which are associated with the mental health are sugar and simple carbohydrates, processed foods, trans fats, and caffeine. So a person with anxiety, mood disorders, and depression should remove these foods from their diet and replaced with the increased intake of protein, healthy fat, vegetables, complex and high nutrient carbohydrates. This will be helpful for the mood therapy of patients. At the end, I would say that a healthy diet associated with a better mood and less depressive symptoms, and a diet high in the refined and the processed foods is associated with increased risk of depressive symptoms and lower mood. So, it is important to have a check on your diet and consider all these dietary factors while treating the psychological cause of these mood and the mental disorders.